I'm going to show how you would set up a modified Knots test. The reason for doing a modified Knots test, you want to run this test on any patient that tests heartworm antigen positive, or if you suspect that a dog currently is infected or has had heartworms in the past. The modified Knots test is much more sensitive than just doing a direct smear, as this concentrates the microfilaria that you'll be able to kind of identify the type that's present as well. Go ahead, I'll place the forearm in here. So that's about 9 mL. You always want to wear gloves when you are working with this, as it is corrosive, so make sure you are safe. I'll draw up from out here, I said about 1 mL of anticoagulated blood. I'm going to put it all into here as well. Now that I have the formalin and the anticoagulated blood, you want to put your thumb over the cap, and you're going to gently kind of invert it over the same place. A mess. You're going to just kind of invert it several times to ensure that the samples are mixed well together. And now that it's done, I'm going to centrifuge it. I already have my balancer in there. You want to centrifuge it for 1500 RPMs for about 5 minutes, and then. So our modified Knots test is finished spinning, so we're going to get it out and continue with the process. So now that it is spun down, I'll kind of show you here. You kind of see a little bit hard maybe to see on the camera, but there's a little bit of a whitish plug about here or so down, which is where it's kind of all settled. So I'm going to dispose of the supernatant being in our hazardous waste. So now I'm going to add a couple drops of new methylene blue stain, which I'll actually get some up in my dropper. 1 to 2 drops is sufficient for this. Cap back on so I don't spill it or anything. Now using a pipette, I'm going to gently kind of mix them. So you don't want to disturb it too much, but you want to get them nice and thoroughly mixed, as the stain will allow you to better differentiate and see the microfilaria. Put a drop on our slide here. Cover with our cover slip. Objective, and you want to scan the entire slide. So normally I will start up in one corner and make my way through. Oops. So this patient with this modified Knots test, there are no microfilaria present. So I'm going to show you how you would set up another fecal test. This is just fecal flotation, just a simple basic one. With you can do it either with centrifuging or without. For this one I'm going to show us without centrifuge. Fecal flotation, the way that the fecal flotation works is when you're using the fecal concentrate, we use zinc sulfate. It goes off a specific gravity. Generally, if the weight of the fecal flotation that we use is heavier than the ova will then float to the top and attach to the cover slip we put on top. This type of procedure is good for like small animal diagnostics. Those ova are generally going to be light enough that they will indeed float, but this isn't a good procedure for large animal. Those ova are going to be too heavy. So the way that you do this, I already have my centrifugal tube with a strainer there to help remove excessive debris. You need a little bit of fecal sample, about 1 gram's worth, which I have, which is about the size of a kidney bean. And then we'll use our zinc sulfate. So, set up here so I can see. So the way here is I'll add my zinc sulfate into my paper cup here, and I'll be wanting to mix it up with my fecal matter to make kind of like a little mixture of the flotation as well as the fecal matter, so you can see there. The strainer will help remove excessive debris. The downside to not centrifuging is that you'll tend to see more excessive debris. For this one here, I'll kind of put it up to the top, then I'm going to remove my strainer. I'm going to top it off the rest of the way with the zinc sulfate. And once that is complete, then place a cover slip on top. Like I said, there again, this allows the ova to float to the top, and in 10 minutes, you need to check it, let it sit for at least 10 minutes. We'll write down the time that I've set it up at. So I'm going to walk us through on how you would set up, for a fecal test, a fecal flotation using a centrifuge. This is very similar to just a standard fecal flotation, except for that we'll centrifuge it once it is set up. That just helps kind of allow excessive debris to kind of settle more go down more to the bottom, while the ova float to the top, allowing it easier to distinguish the ova that you might see. So for this, I already have my centrifugal tube set up. I have a little my strainer there with the funnel. The strainer just kind of helps get rid of any excessive debris. I have my sample here. You need about 1 gram's worth of fecal matter, so that's about the size of a kidney bean there. I have it in my cup, ready to stir. We use zinc sulfate, so I add a little bit into my cup here using my wooden applicator. I'll mix it up so we get a nice kind of little soupy mix here going on. You want to kind of try to break up the fecal matter as much as possible. Once you've stirred it in, I'll go and using my strainer, I will funnel it in. With the way that we have an angled centrifuge, so I don't fill it up quite all the way to the top, but I fill it up to about the 10 milliliter mark. I'll put that there, put this in here. And so like I said, since this is a centrifuge, I don't fill it up quite to the top with the way our centrifuge is. I have my balancer in there. I'll place it in. We're gonna centrifuge it at 1500 RPMs for about 5 minutes. So in 5 minutes, alright, so our fecal flotation with centrifuge has finished spinning. So now when I bring it out, you can see it's kind of, a lot of stuff has settled there at the bottom, which is what the goal is. So I'm going to place it here on our rack. For this one, we top it off with the zinc sulfate. Then place a cover slip on top. And it needs to sit for at least 10 minutes. So I'm going to show us how you would set up a direct smear for fecal. That way you can see if there's any parasites. The direct smear is kind of the most basic, most simplest form for fecal testing. It's, like I said, easy to set up, quick. You can find basic parasites on there. It's also really good if you suspect Giardia. You can see the cysts on there typically. So here you can kind of see I have my sample ready. I have a little bit of saline drawn up, a wooden applicator to mix, and a slide here on a paper towel, because it does get a little bit messy, especially when I pour it. So here you just need a small amount of sample. You can see I can put it on here. You probably don't even really need that much, actually. Let's see if I can get this split in half. There we go. So I have just a little bit of my sample there. For this, really, you also just need to mix a little bit of saline on there. And once you have both the saline and the fecal sample on there, you kind of want to gently mix it with the wooden applicator. You want to make sure that you want to spread it out so that it is thin enough that you can easily read through it. That way when you were looking at your fecal sample, you were able to appreciate any ova that you might come across. There you go, I have it kind of spread out there, as you can see. Then I would simply take a cover slip that I have ready here, and I would drop it on top. Oops, a little bit of a larger piece there, let me move that out. And now once it is prepared, I'll be able to go and look at it under the microscope and see what I find depending on parasites and or Giardia. I'm going to show you how you would set up another fecal testing method using sedimentation. Sedimentation is particularly helpful in large animal science. Normally their parasites, their ovids are going to be too heavy to float. So with sedimentation, everything's going to settle on the bottom of the tube that you use. So therefore, that is where you would recover the sample that you were going to look for. For sedimentation, I have my sample here that we're going to be using. You need a little bit of a cup. Already have a centrifuge tube with my little strainer ready to go. The problem with sedimentation though is that it doesn't really concentrate fecal debris, so you're more likely to see some of that. So which might make seeing the ova a little bit more difficult, but there again it is helpful when you suspect those heavier parasite ovas such as flukes. So I'm going to get my gloves on here. I'll walk us through this process. So you need about 2 grams, kind of put us down here so I can see, you need about 2 grams of your fecal sample. So here you can see I have that amount. A gram is about the size of a kidney bean, so that's about 2 kidney beans here. Then I'm going to kind of fill this with tap water. We use tap water, that way the eggs will settle at the bottom versus float. I'll kind of gently mix it all in with a pipette, make a little sample here of our mix. And once it's mixed, you can see the tube here. I'm going to pour it through the strainer. That will help get rid of some of the debris, though there again, not all of it. I'm not going to fill it quite all the way as we don't have a fecal centrifuge, but a regular one. And so this now, I already have my balancer in here, so I'll set it aside like so. I'll close it. We're going to spin it for about 1500 RPMs for about 5 minutes. So our sedimentation sample has now stopped spinning in our centrifuge. Also make mention here, for this sample I centrifuge it for 5 minutes. You can also allow the sediment sample to sit undisturbed for 30 minutes. That will allow time for the sediment to settle at the bottom of the tube and allow you to perform the same process as I'm about to show you now. So here, I'll go ahead and I'll pull it on out. I'll show you here, so you can kind of see, didn't get a whole lot of sediment in there, but you can see a little bit there at the bottom. So I'm going to pour off the liquid. I want to be careful to not disturb it. You can still see I have the sediment at the bottom. And so now using a pipette here, I want to make sure you have one long enough. Okay, and there. Have a little bit on our slide. For this one, I would just add a cover slip, and then I would check it under the microscope, and that is how you check a sedimentation fecal sample. So we're going to be talking about the different methods of urine collection. One of those methods that we're going to focus on in this segment is a free catch. A free catch sample is useful for if the owner is unable to bring the pet in but we want to check a urine sample, they can catch it at home and bring just the sample to us. This method can be used when you're not planning on sending off a culture. If you're sending off a culture, a free catch is not the way to go. But if no culture plan, a free catch is okay. The best time of day to catch a free catch urine sample would be kind of first thing in the morning, first morning sample we call it. These are going to be, the urine is generally going to be the most concentrated first thing in the morning, as well as be free of any dietary factors. When you're catching a free catch urine, and we'll show this here in a few minutes when we go outside, you want to collect it midstream. This way, this kind of helps reduce the chances of potential contamination. Once the pet has urinated for a second or two, you don't want to wait too long in case they run out. Then you want to place the bowl or cup or ladle underneath it. That way it kind of catches it midstream. The first bits of urine will kind of have flushed out any potential contaminant. Then you kind of have a cleaner urine sample at that point. Things you need for free catch: short leash to keep your pet close by to you to make it easier to collect the sample once they do start to urinate, as well as really anything to catch it in. It can be a bowl, a ladle. I've seen, plastic cup. I've seen owners bring a urine sample to us in a plastic baggie before. If it has an opening and it's clean, you can catch the urine in it and bring it to us that way. So now here in a few minutes we'll go outside and I will show the proper procedure and demonstrate of how you would perform a free catch urine sample. Alright, so we're going to catch a free catch. See, I got on a nice short leash and my bowl here at the ready. Wait for her to start urinating so we get a midstream catch. There we go. You can see the urine, got a little bit there. Kind of more of a straw colored, but pretty fairly clear. Pretty stinky urine too, so that's always good to know for the gross exam for the urine. And now we'll go and run our diagnostic test on it that we need to. So talking about urine collection, one method you can use is doing cystostasis. This is where you take a needle, you go through the wall of the abdomen into the bladder and collect it that way. This is one of the most sterile ways to collect it. So if you are having to culture a urine sample, this is the collection method that you want to use. Things you'll need for it is you will need, we have a 3cc syringe with a 1.5 inch long needle, so you have plenty of room to reach it. I'll have a white top tube ready, as well as a fresh needle to place my collection in there. That way it is ready for culture. So here I'm going to be doing it via ultrasound. This is an easy way you can easily visualize the bladder and use it to guide your needle in to the bladder. You can also do a blind stick by having the pet laying lateral recumbency. You can feel and isolate the bladder and feel it that way, and stick the bladder that way as well. Here we're going to show collecting urine via cysto. I'll spray some alcohol on the lower abdomen here on my screen. You want to kind of triangulate the bladder to make sure that when you enter, your needle ends up underneath the probe. As you can see the bladder on the screen. Remove my needle. You want to kind of go at a steep angle and you want to end up right underneath your probe. When I'm in there, I'm going to gently pull back. It's important to note that when you are in there, you do not want to redirect your needle, as you can cause damage to the organs, which obviously is not a good thing. So once you have the sample, you release the plunger, pull straight back out. Once you have your sample, it is good you want to switch out your needles. This way, when you are collecting your sample for culture, you have a needle that is free of any potential contaminants from the skin. So fresh needle, put it straight into my white top tube, and that way you have about a little bit of urine, about 1/2 ml for your culture sample. Should the need arise, you have a nice fresh sample free of contaminants, and that is how you would collect urine via cysto. So on the sample that we just collected via cysto off of Landon, I just want to make some comments on the physical characteristics of it. This urine is, I call it kind of a pale yellow. Looking through it, I can see the numbers through the syringe, so it's actually fairly clear, maybe just very slightly cloudy. And the smell, when I smelled it, was kind of a moderate smell, which is pretty normal for felines. So I'm about to show how you would perform urinary catheterization on a male dog. Reason why you would do this is another option that you can use if you're needing to perform a culture on a pet's urine, but you cannot perform a cysto for some reason. The reason why you might not be able to perform a cysto would be, if the bladder wall is compromised. If you suspect cancer, you will not want to compromise the bladder wall, so therefore you can go directly into the bladder through the penis and the urethra to collect urine this way. Some things you will need for it, as you will need to keep this an absolute sterile so you do not introduce any bacteria into it. You have your urinary catheter that you choose that is kept sterile, sterile gloves, as well as sterile lube, as you want to, there again, you don't want to be sticking up there dry, but you want lube that is sterile. So here in a moment we're going to get ready and we will perform a urinary catheterization. So there's a few different type of urinary catheters that can be used when you are catheterizing any dog. The ones I'm going to be talking about are the polypropylene, the red rubber, and the Foley catheters. The polypropylene, those are kind of going to be like your Tomcats, longer catheters in general. Those ones are generally pretty easier. They're kind of the easiest of the three to place due to their flexibility. They tend to be more irritating to the patient, however, so really you just want to use those if you're just going to be catheterizing the patient for, one time, one and done, and then remove it. That way you're not causing that irritation to the patient. The red rubbers, those are good in both male and female dogs. They're kind of a good all-around catheter placement. They're going to have a good size range too, so whatever size patient you're using, you're going to hopefully be able to find a size of the red rubber catheter that you can use. The Foley is the catheter that you're going to want to use if it's going to be a long-term catheter placement. The Foleys, they have a balloon at the distal end, so once it's placed you can fill that balloon with air or water, and that will prevent it from slipping out of place, so that'll help keep it in place for that long term. Here in a little bit, we're going to go through the steps of catheterizing a male dog, and we'll discuss the steps as we perform that. So we're about to do urinary catheterization on Odin here. So here we have him laying in lateral recumbency. You can also do it in dorsal recumbency, but for him, he's more comfortable this way. So I have a 22-inch 8 French red rubber here. I'm going to kind of estimate the length. So from the tip of his penis here, I'm going to place it there and kind of moving around roughly where the urethra would be. This should end up right about where the entrance of the lumen of the bladder is, so that should be a good length so we don't extend too far. So the penis has now been extruded, and my helpers here are going to go ahead and clean it and then flush it with saline. That way everything is sterile before we place the catheter in. You want to make sure that you do follow strict protocol in keeping everything sterile, as you do not want to introduce anything to the urethra or into the bladder. Okay. Easy, bud. We'll have one more wash here, and then it will be flushed with the sterile saline that we drew up. A sterile loop here that my helper is going to open up sterilely. I just put my sterile gloves on, so this area here is sterile as it was a package. You can see that she is squeezing from the bottom to keep it all sterile. Perfect. Alright, so now she's going to also give me the catheter sterilely as well. So here I have my catheter. I'm going to put it very carefully in the lube that is sterile. That way for the insertion it is a smooth process. And if you can move the video so you can kind of see what I'm doing here more better. So I'm going to very gently place it at the tip of the penis. I'm going to gently insert. You might feel a little bit of resistance at the os penis, but then as we come closer so you can see. Once passed, if you extrude it a bit more. Once past the os penis, it should slide in smoothly. Good. There we go. Good. It's going to come, it'll curve around the urethra, and should be, once I reach the lumen of the bladder, I get some urine flow. I'm going to just gently, slowly advance the catheter, as I do not want to cause any damage. So once I do reach the entrance of the bladder, I should have some good urine flow to indicate that I am. There we go. So now that I am there, you want to discard the first little bit of urine. Think of it kind of like as a mid-catch on a free catch, midstream free catch. This way it gets rid of any potential bacteria that got placed up if you open up my that there and hand that to me. And just the bladder, I'll place my catheter tip syringe onto here, now that some has been discarded, and I'll draw up some urine. Now that I have our sample, I would gently withdraw. My hands are a bit slippery now from the lube, so I cannot just detach that current. I'm just going to slowly pull it out, that way it doesn't cause discomfort. And now I am clear. So our sample here is, I'll call that a pretty, actually fairly dark yellow. Looks, the numbers on the syringe, I can't see through it, so it's actually also fairly cloudly. Fairly cloudly. I'm stumbling there. And the smell from the urine was a pretty strong odor to it, which is all good to know for your physical characteristics. So I'm going to perform a ear cytology here on Miss Buttercup. Some things that owner may have noticed that symptoms presenting with would be, scratching at the ear, shaking the head, redness, irritation. In cases like this, it's always good just go ahead and take a sample from both ears as opposed to one, as sometimes if there's cocci in the ears, those like to travel back and forth. So for this, before I do it, to help reduce damage, I'm going to kind of moisten our swabs with some saline. I'm going to lift the ear up, make sure we can see here. Kind of want to make sure I get deep down in the canal by gently going in. I kind of pull up to help straighten it out. Make sure I rub up against the edges of the walls there. And you see I was able to get some debris out there. That was the right ear. So there again for the left ear, I'm going to do the same process. Moisten our swab. I'm going to bring this around here. I'm coming into here doing this. There again, going slowly in and deeply into the canal to make sure I do it. Rubbing up against the ear canal. Gently pulling out. That one I didn't get quite as much. You're going to kind of gently roll it back and forth. You don't want to drag it, as that can cause damage to the sample. So I'm going to roll gently a good bit across. You can see I now have some sample on there. Same thing with the right ear. I want to make sure I leave some separation between the two. So once again, I'm going to gently roll. The right ear had a little bit more debris than her left ear. See what our microscopic evaluation is. So there you see I have it on both. For ear cytologies, we use a lighter and just kind of gently run it through the lighter. That just kind of helps get rid of any potential wax debris and also help the cells and bacteria set. So I normally take them all off here, and I dip it in the first one there. So normally for this, some people do 20 dips, others, I myself, I do 20 seconds each. The reason why I do the 20 seconds instead of 20 dips is I found that my 20 dips tended to be, my dips would be fast. And so therefore I just set it in for 20 seconds. That way we get a good, nice, even staining across, which helps the microscopic evaluation here, that we'll see here in a minute or so. So normally I have the counting the seconds on my watch. So there, once it's been roughly 20 seconds, I find my dip a time or two and move on to the next stain. Of course, once I place it in the stain, I close the stain that it was just in. That way I don't spill anything or anything get dropped into it. There we go. So what we're looking for on the microscopic evaluation will include things such as, bacteria is the main thing that we are looking for. You can also find yeast buds on there. Those generally look like, some people describe them as peanuts. Some people describe them as footprints, but you also have to watch out for the little budding yeast too. So we're almost done with our staining process here. Once it's stained, I'll rinse it off with distilled water, and then I'll let it, we generally use a hair dryer to dry it off in a timely manner rather than letting it drip dry. All right. Place this on the placement here. Just slides right on in there. I tend to just start with the left ear just because that's how my routine is. So looking at the forks gives you a good overview of where is the most action, where can I find where the excitement is. Once you find that area, always good to move a little bit closer in, going to the 10x. There again, you can kind of fine-tune right exactly where you were looking at for any exciting areas. There's some debris there that I'm able to look at. Move to 40x, there again, fine-tune right where I'm looking at to make sure that when I go into a higher objective, I'm not way off my base and searching. Now I'll move to oil. When you're looking for bacteria, you need to use oil. So add a drop of our oil and move to the oil objective. And on here, so I can clearly see if there's any bacteria. When you're looking, you want to look ideally at least 10 fields. This gives you a good overview of what's going on. Sometimes you need to look at a few more depending on the placement and disbursement of everything. So far, on Miss Buttercup's left ear, not seeing anything. So that would be what we would call NSF, or no significant findings. I will then go to her right ear. There again, starting on a 4x. Where is the most excitement going on? Of course, I already knew that there was some extra debris on there, so I'm kind of focusing on that area because that's where the most excitement is going to be at. Moving through each objective lens. As I zoom in, fine-tune where I am looking at. That way I don't get off and have to go hunting for my spot. So once I'm zoomed in, add a drop of oil. Go to the oil immersion lens. And slowly using the fine-tune. Well, it does indeed look like in her right ear she might have a touch. She does have a touch of yeast, I see. So when talking about dermatology testing, we're looking at, fungal testing. Those are oftentimes we're going to be looking like using a DTM as a medium. There's a couple of different methods of collecting. One such way is to use plucking the hair using sterile hemostats. When you're plucking the hair, you're going to be using these when the patients present with classic lesions. You want to pluck the hair from the edges of those lesions. Ideally, 10 to 20 hairs should be a good range to help kind of raise the chances of getting a positive culture and seeing what's going on there and being able to treat properly in the coming days. Another method you can use to collect hair is using a toothbrush. This toothbrush needs to be a fresh one, preferably that's already kind of been wrapped in plastic, so you know it's sterile and as well contaminant free. But you want to use the toothbrush method on patients that don't present with those classic lesions. If there's no lesions or just very odd lesions that you don't have that nice edge to collect the hairs from. When you're using the toothbrush method, you're just going to kind of gently brush the hair in the direction of the hair, focusing on the base of the hair. Approximately 30 or so brush strokes will be sufficient to get enough sample to test, but if you notice a lot of hair or scale buildup, then you want to kind of go ahead and stop at that point and proceed with performing the test then. So I'm going to collect my fungal testing on Lila here. You can see she has a couple it's a bit hard to see in the video, but she has a couple small red lesions. The owner's already been treating them, but we're just going to kind of do a testing on them just to make sure. With my hair sterile hemostats, here you can kind of see there's a red lesion here. I'm going to come and I'm just going to gently pluck some of the hairs and place some on the DTM plate. You want a good number of hairs, that way you have a good sample. I'm kind of plucking from a couple different spots around the area, also to get a wide spread of the samples. So now that we have our DTM ready, we're going to prepare a slide for it. So first off, I'm going to put a drop of our lactophenol cotton blue on the slide. That way we have that prepared for staining purposes. So once I have that ready, I'm then going to grab my piece of tape. And using this tape, I'm going to place it into our DTM tray here. I gently collect my samples. The tape will act as a cover slip as I place my sample into the drop of the cotton blue. And now I'm able to come and look at this. Generally, you're just going to only need low power. I'll place this here on the slide here. And this will allow you to look for any sort of fungal that may show up. So as I'm looking over, I'm going on low power right now. The tape, it does act as a cover slip, so if you needed to go to high dry, you can do so. But generally, you're not going to need to unless you see something that you need to really kind of zoom in on and check out. Which I'm looking all around my sample here, checking out the hair follicles, making sure nothing's growing on those. Not seeing any fungal such as like the dermatophytus, so I would call this sample NSF or no significant finding. So we're about to perform a skin scraping on Lila here. Some things of why we would do a skin scraping would be if the patient presents with looking like lesions, which Lila does have a couple smaller red lesions. So we're just going to check those areas, make sure that there's not any ectoparasites that are hanging out causing these lesions. So what we have, I have a slide already at the ready here. I have a 10 blade, which I'm going to dole on the edge of the table, some mineral oil. First off, I'll go ahead and we'll dole my blade on the table here, which you see that way it's not as sharp for the patient, less likely to cause potential harm. For the scraping, I'll add a drop of our mineral oil. Make sure I get a drop in my dropper. This is just to prevent the any from the sample if there are any parasites, that way they don't decide to run off. Put a little bit on my blade here too for the same reason. I'm going to gently pinch the area, keeping my blade perpendicular. I'm just going to do a superficial scraping around. Generally, kind of the larger area you're able to get, the better sample you can get. For the superficial, you just want to, you do not want to draw any blood like you would in a deep scraping. So I'm just making sure I'm getting some of the skin follicles, but I do have some of my sample there. So now I'll place it here very carefully from the blade into the mineral oil on my slide. And now we'll take it to the lab and we will examine the sample. Start the microscopic evaluation of this. So I did a superficial scraping, which would be good for certain mites. However, most mites such as Demodex or other various forms of mange, you would want to do a deep scraping because you would have to get that capillary blood. But superficial, you could also be looking for certain bacteria. So right now I'm looking on 10x through my sample. So far it's coming up pretty clear of anything, which is good. At least this way with the cover slip on, if I see anything that's questionable, I can zoom in. Which on this patient, I would say that Miss Lila, for her skin scraping, would be NSF, no significant findings. So we're going to be showing how to perform a necropsy. I want to kind of discuss why we would do a necropsy in the first place. Necropsy ultimately is to determine the cause of death. This could be helpful if an owner had a patient die suddenly with seemingly no sickness or illness involved. That can kind of give them peace of mind as to what happened. It can also help determine cause of death on if it was parasites, toxins, illness. It's also good in research as well to see, one, was the diagnosis correct, and also were there any negative or positive impacts from the treatment plans that was put in place for those. Started. Both myself and my Dr. Blazak here are wearing our personal protective equipment of mask, gown, and gloves. You can see here our body is ready to be necropsied. We have a couple biopsy jars ready for our samples taken. And we have our instruments laid out, Metzenbaum scissors, Mayo scissors, a couple different forceps, scalpel blade with the handle, hemostats, and as well as some needle drivers for closing up afterwards. So we'll get it all set up and get started here.
So to start the necropsy, the first thing we're going to do is an external exam. So just like a physical exam, we're going to examine the body for any wounds, any lesions that might indicate a problem. So we will kind of look at every body part and make sure we're not seeing anything. As long as the body is not too stiffened, we can also open the mouth and assess for any concerns or problems. But I don't see any external abnormalities that would concern me on this rat. So we're about to probably enter the abdomen through a ventral midline incision and start looking at the abdominal organs. Midline from the xiphoid all the way back. So this will allow us to individually examine it, but also what we're going to do is we're going to open up to see the interior surface. So I'm going to have Heather do that now. She can enter the stomach to see the contents that are in the stomach. And once she gets through the serosal and mucosal layer, we can open up and see what is in there. So examining the inside of the intestines might give an indication that something had caused some damage to it. Here's our little spleen. We're going to use this, even though it looks fairly normal on exam. Let me make sure. There are some white material, but I think that's from the stomach, touching the food material in the stomach. So this spleen looks pretty normal, but if we wanted to obtain a biopsy, it's so tiny we could theoretically send off this entire organ, but we don't necessarily need to do that. If we want to do multiple tests on this organ, we may not want to send the whole organ into formalin. We may want to put pieces in different things. So in order to get a sample, we can either use a scalpel blade, or what might be easier is just scissors. And so these are Metzenbaum scissors to cut through this organ. And we're just going to take an edge of it, or if there was an abnormality, we'd take a piece of that. So we have a piece of tissue here. We want to put that into formalin, which we're not going to do this for purposes of not wasting formalin jars that we use for surgery in actual cases, but we would want to put this in formalin with 9 to 10 parts more formalin than there is a biopsy. If we do not have enough formalin in the jar, it will not fix this organ as well as we need to. Biopsy sample, I will let Heather do this one from the liver. We will want to make sure we know which liver lobe we're taking it from, so that requires knowing the anatomy. And then, we can just take an edge, or if we actually see a lesion, potentially we could directly biopsy that lesion. This liver looks fairly unremarkable to me, and I don't see any abnormalities, so we will just take a general portion of it. So I will have Heather just cut a little piece off. My glove is blocking it. There we go. Okay, there's the piece, and she will be placing it in a jar of formalin. Alright, so we are going to cut through along one side of the sternum through the chest, and as you can see, it's hard to do that, so it's not ideal for larger animals. We would want to enter a more appropriate method, but this is a small little rat that we can get through and open the chest cavity and look further at the lungs and the heart. The sternum, I had to transect part of the diaphragm because it was holding the sternum kind of together. If we look, we can see the lungs here. The lungs are going to be very atelectic because this animal is not alive, but we will look for any discoloration of the lungs that might indicate anything abnormal or a feel. We will palpate these lungs and make sure we don't feel anything hard that might indicate some type of pneumonia or tumor or mass. Here in the center is the heart, which you can see is very large. And we will feel the heart, but we will eventually take the heart out and cut into it to examine the chambers of the heart for any thickening that might indicate heart disease.
So as my doctor mentioned, they didn't want me using the actual formalin jars in the procedure, but he explained the process. You need 1 to 9 for the formalin to the body parts that are biopsied, and so for the labeling on here, we would put the date that the samples were taken. We put the patient name, which this is a rat that I started calling Scabbers. We put the client's name if applicable. We would also put the specimen. So we took a biopsy from the spleen, so we would write spleen on there, and as well on the other sample we would write liver, as well as the date, the pet's name, the client's name if applicable. We're going to be collecting a vaginal swab for vaginal cytology on Lily here. She's in for a dental. You can see the monitors in the background there. So first off, I'm going to clean the vulva with chlorhexidine here. My helper is holding them open currently and kind of more dorsally. That way when I go to collect the sample, I have a nice clear angle, able to get a good swab. And Jess, if you could open up my sterile swabs here. Alright, so I have my sterile swab here. And keeping it sterile, I'm going to moisten it with 1 to 2 drops of sterile saline that I drew up already. Now, for entry, you want to go kind of at a 45-degree angle dorsally. And then once you're in, you then will go horizontal. That way you can swab against the vaginal walls to get a good sample. You can carefully pull out, and there I'll have my sample. So now we'll take it to the lab to prepare it for cytology. So now that we have our vaginal sample, we're going to take our frosted slide, and we're going to gently roll the sample back and forth on the slide. You do not want to rub, as you can damage the cells this way. But you're just going to gently roll back and forth until you collect a good sample. And then we'll move on to staining it. So we have our sample, so we're going to start staining it. So here we have our 3-step diff quick. So I'll place it in our fixer for about 20 seconds or so. And while we're staining it, we're going to talk about the different stages. So there's the proestrus of the estrus cycle. In this here, clinical signs, you're going to see swollen vulva, some red discharge. Under the microscope, really, you're going to cytology, you're going to see red blood cells, basal and parabasal epithelial cells. Those are going to be your kind of microscopic signs here. So now I have 20 seconds. So move on to our next step. On estrus stage is going to be pink to straw colored discharge with all squamous epithelial cells. Normally those cells are going to be cornified and usually anuclear. This is kind of the next step. And then the third step of the cycle is the metaestrus. Here you're going to see swelling and discharge are decreased with non-cornified and squamous epithelial cells. You're also going to see a good amount of debris under the microscope as well. This is also sometimes, if you see this during the day or day after a breeding attempt, you might see some sperm as well. And anestrus, the final cycle, this is going to be, there's no swollen, no discharge when the patient presents. Under the microscope, predominantly non-cornified squamous epithelial cells. So these are what we're going to be looking for under the microscope. Some reasons why we might check a vaginal cytology is if the owner is looking to breed. If they're wanting to breed, you want to know when cycle, you want to know when is the best time to do it. So doing it kind of when they're going into the proestrus cycle or the metaestrus cycle, those are going to be the times that you want to check this. So now we're going to move to underneath the microscope. So now that our vaginal cytology is stained, we're going to take a look at it underneath the microscope to see what stage of estrus Lily is in. So I first go in, I'm kind of finding where my sample is at. There's a good cluster of cells. So the more I zoom in, I'm going to go to high dry here in a moment. These are looking, they're large cells. So I actually don't need to go to oil immersion. But when I'm looking at these cells under the high dry power, the edges are rounded. There's basophilic cytoplasma. The nucleuses are good size. So looking at these, go check out some other ones just to make sure. So as I'm looking at these would be classified as the non-cornified squamous epithelial cells, meaning that this particular pet is currently an anestrus. So we're going to be doing a manual, major, and minor cross-matching. You want to perform this whenever you're going to be performing, giving a blood transfusion to detect any potential, lessen chances of any reactions. So the reason why you want to do both a major and a minor cross-match is that the major would detect abnormalities between the donor's red blood cells and the recipient's plasma, and the minor is kind of vice versa, the donor's plasma and the recipient's red blood cells. The way that you would tell if there are any abnormalities would be if there's agglutination or any hemolysis. So here in a minute I have my blood samples drawn here. You can see here I have both in the serum for both the donor and the recipient, as well as blood in for our EDTA tubes. So here I'm going to be getting those centrifuged. So now that my blood samples have been centrifuged, I'm going to take the serum from each of my samples here, making sure that I go donor to donor. I just need to take the serum off and I'll put it into a plain red top tube. This is indeed. You want to make sure that your tubes are carefully labeled so you do not mix anybody up. Go. And I'll do the same for my recipient, Odin. There again, just taking the serum off. Using a pipette, mixing it into a red top tube. So my EDTA tubes have now been centrifuged, so I'm going to want to decant the plasma. So what I'm going to do first off is I'm going to place 1 to 2 drops into this 15 ml centrifugal tube, and then I will add 12 mils of 0.9% sodium chloride. You really only need 1 to 2 drops, and there again I'm being very careful to make sure that 1, 2. That I have my plasma in my tubes ready to go, I'll add 12 mils of 0.9 sodium chloride. This is to help wash the red blood cells there. Now that I have it in the tube, I'm going to gently mix and invert. This is how you would wash them, and so now I'm going to centrifuge both samples for 1 minute at 34 RPMs. This is be done a total of 3 times, so after this time I'll do it twice more. So now that I have washed the red blood cells for a total of 3 times each, I'm going to take 0.02 mils of the pack wash erythrocytes and to make our sample. A little bit difficult here, but you can see I have 0.02. I'll add it to the same tube there again, making sure that I do not mix them anywhere. And then I will add 0.98 mils of 0.9% sodium chloride to it. And then I have my 2% erythrocyte suspension that we'll use for the rest, and I will do this with this recipient sample as well. So I'm going to make the major and minor tests now. For the cross matches here, I have them labeled both major and minor. So to start off with the major, I need 2 drops of the recipient's serum. So I'll take up that. And I'll drop 2 drops into here. There's 1. Got some air bubbles, so we get rid of those. And there's 2. And also with that, for the major, I need 2 drops of the donor's erythrocyte sample. So take it out. We're going to have 1 and 2. For the minor cross match, it's the reversal. I need some more. So I'll have 2 drops of the donor's plasma. One, 2. And I'll have 2 drops of the recipient's sample as well. Into my minor here again. 1, 2. So now those are set up. So setting up controls for each animal, I have them labeled as donor control and recipient control. For each one, I need 2 drops from each of their samples, the serum and the suspension. So just very carefully. 1, 2. Same for the suspension as well, 2 drops. 1, 2. And doing the same for the donor. This way, once I'm ready to check for any reactions, I have a control to check the major and minor cross match against. 1, 2. So to make the final preparations for my major and minor cross matches as well as the controls, I'm going to let them kind of gently rock back and forth so that they get fully mixed. That way they are ready, and then once they have kind of been inverted a couple times there, they will sit for about 30 minutes at room temperature, and then we will return to complete the steps to this major and minor cross match. So now that my major and minor cross matches and my control tubes have sat for 30 minutes, we're going to examine them. First, we're going to kind of do it macroscopically. Looking in each one, these are my donor control and my recipient control. I'm looking at it and seeing, is there any hemolysis? Is there any agglutination? I can kind of gently shake them here, and in these control ones, there shouldn't be any. That is why they are the control, so you can make sure that you get accurate results for the cross matches themselves. So now that I've looked at those, I'm going to look at my major cross match here. And also there again, I do not see any hemolysis, any agglutination. Gently tapping it, looks like it's all kind of mixing well there. Same thing with my minor cross match. Don't see any signs of hemolysis or agglutination. Gently tapping it, nothing. So I'm going to go and check them under the microscope now. So we're going to be doing this microscopically now. First, I'm going to check the control tubes. So for each one, I just need a slide. I'll check the donor control first. I'm just going to I just need a drop on a slide here. And for this, you can just look at it at low power. So that one way. So you're just going to see if the red blood cells that you see on here are evenly spaced. If they are, then that is good. If they are not, then there's a problem with the control and you need to go and look. I can lower the condenser to help make it easier to see. And on this one, they are all evenly dispersed. So that was the donor control. So now I'll check the recipient control. So looking on here again, there again, I'm looking to see if the red blood cells on the slide are evenly dispersed. And once again, on the control, they should be. I can lower and raise the condenser as needed, and everything looks good. They're all evenly spaced. So that both of the controls came out as the result should be, and so now we'll move on to the major and minor cross matches. Alright, so we're going to check our major cross match for hemolysis or agglutination under the microscope. Sufficient. So when I'm looking at the sample here, I'm looking at the erythrocytes, the red blood cells at my sample. They're all evenly dispersed, which is a good sign so far, showing that there should not be any reactions. Of course, I still also want to check the minor, just to be sure. The major is showing compatibility. Now I'm checking the minor. I'm checking them all on the same power. That way, they'll all look the same to me in each one. These are also all evenly spaced. I do not see any signs of any hemolysis or agglutination under the microscope. And so that to me indicates that Lila, who is our donor, and Odin, who is our recipient, they are compatible for transfusions. So in the future, if these patients are in need of that, they would be safe to use each other.